Researchers at the National Institutes of Health say they have used gene therapy techniques to add a corrected gene for healthy red blood cells into the bodies of 9 test patients, replacing their diseased red blood cells caused by sickle cell anemia and effectively ridding them of signs of the disease. NIH Director Francis Collins described the trial results as seemingly spectacular.
Now, when you look at their blood counts and their blood smears, it looks like they don't have it anymore. Now, it's early days. We've only followed these patients for a year at the most, but it looks like it would be fair to say this could be a cure.
Sickle cell disease is an inherited blood disorder that causes protein crystals to form inside red blood cells, changing their shape from a flat disc into a crescent or sickle shape that then clogs up the small blood vessels and results in terrible episodes of pain and organ damage. Collins says the disorder comes essentially from a misspelling in the gene for one of the proteins. In the clinical trial, a normal copy of the gene with the correct spelling for healthy red blood cells was placed inside a virus that allowed the good gene to multiply many times over. The virus was then introduced into the patient's bodies via bone marrow transplants, but only after toxic chemotherapy to wipe out their normal bone marrow in order to create space for the corrected genes to go. According to researchers, within 2 or 3 months, the 9 patients showed signs of remission.
We're simply adding the gene. We leave the defective gene intact. So this is what's called gene addition therapy.
The researchers at the NIH believe there are some 7,000 other diseases that could benefit from the single gene addition therapy used in the sickle cell trial, including a white blood cell disorder called chronic granuloma and possibly one-day cystic fibrosis.
This is going to take a lot of hard work over many years, but the proof of the approach being potentially curative is now in front of us.
Joanano, UNTV News and Rescue.